Good morning. We're going to get started here in another minute or two, so just welcome and sit tight. We're going to get started here in just a few seconds. We're waiting for everyone to join. Looks like our attendance is definitely increasing by the second here, so just give us another moment and we'll get started. Hey, good morning. Thank you for joining today's webinar, which is going to focus on HPIO's 2026 Health Value Dashboard. We're going to talk about using data to promote policy progress. I'm Amy Rowling-McGee, the president of the Health Policy Institute of Ohio. I'm going to be joined here today by a number of my colleagues at HPIO who are going to share the findings from our 2026 Health Value Dashboard. HPIO is an independent and nonpartisan organization. Our mission is to inform data-driven policymaking that improves health equity, and the value of healthcare spending in Ohio. We'd like to extend our gratitude to our core funders who support HPIO's mission and our work. And we'd also like to thank our 2026 Educational Event Series sponsors who support this webinar and our events and our Health Policy Summit throughout the year. As always, today's presentation slides will be available on the events page of our website, and you can find a link here on the screen to our QR code that'll take you right to the presentation slides. Or you can go to hpio.net and click on the Events tab to access the presentation slides. As our speakers are presenting, please feel free to type any questions that you have into either the chat box or the question box, and we'll address them as time permits. We're also going to have some poll questions for you at the very end, so please stick around for those. Again, the focus of today's webinar is our 2026 Health Value Dashboard, which was released on April 17th. We've produced the dashboard every 2 years since 2014, and this is the 12th edition of the dashboard. It's a collection of tools and resources that compare Ohio's performance to other states on over 120 metrics related to population health, healthcare spending, and all of the factors that influence health. Many partners across the state serve on our dashboard advisory group. We thank all of you who are on this call today who have contributed to this effort, either for the current iteration of the dashboard or past iterations of the dashboard. The dashboard puts data in context, provides concise, high-level key findings, makes the case for evidence-informed strategies to address our greatest challenges, and sparks questions. That's a very important addition to our thinking about what the dashboard accomplishes. It is very far from answering all the questions we have around Ohio's performance on health equity, and healthcare spending. It really gives us a foundation of data that often sparks new questions for further analysis or research. The primary purpose of the dashboard is to catalyze data-driven policy development that improves health equity, and the value of healthcare spending. In the dashboard, we acknowledge and measure the many factors that contribute to our health, from access to care, to the quality of services we receive in our healthcare system, to public health and prevention, and the social, economic, and physical environments in which we live. Or to put that differently, the communities where we live, work, and spend our lives. The research is clear that well-resourced neighborhoods and public health infrastructure, in addition to high-quality, accessible healthcare, support people's ability to make healthy choices and to experience good health. The dashboard includes data on all of these areas. A key theme that's emerged across the dashboard findings is that Ohio's progress overall relies on intentional efforts to reduce the barriers that Ohioans with greatest needs often experience. We know that there are many groups of Ohioans based on their race, income, where they live in the state, disability status, sexual orientation, or gender identity, have limited access to the environments and experiences that support health, or perhaps encounter more barriers to health. As a result, these Ohioans are more likely to face challenges with access to quality care, stable housing, steady jobs, and ultimately health outcomes. Our dashboard includes disaggregated data so that progress on closing those outcome gaps can be tracked over time. We know that when we remove these barriers and support Ohioans that are facing the greatest challenges, we create opportunities that result in more resilient families, healthier communities, and a stronger economy for all of us. Next slide. So today's webinar is going to feature several colleagues of mine here at HPIO who are going to explore the findings from the dashboard, as well as the resources available for further exploration of the data. Our first speaker today is Dr. Lexi Chirakas, who focuses on data management here at HPIO. She's going to review the methods and the results from the 2026 dashboard. Lexi?
Thanks so much, Amy, and thank you again, all of you, for joining us today. We're so excited to have you. Like Amy said, I'm going to take you through some of the major changes to be aware of in this edition, as well as share some high-level analysis. And then finally, before we talk about key findings, I'll share with you the resources that are available to you on our website for your own exploration. So like Amy mentioned earlier, in the 2026 version, we convened a group of advisory stakeholders to help us update the methodology and metrics that were included in the dashboard. Our hope was to make them more relevant for the current policymaking environment. We added several metrics around specific causes of mortality. We added an entire subdomain around maternal and child health. We also added some metrics around behavioral health and care quality that we hope makes the dashboard a more realistic picture of Ohio's greatest health challenges. Next slide, please. So the dashboard achieves its goal of highlighting Ohio's strengths and challenges by putting data into context in these three ways: through rankings at the domain, subdomain, and individual metric level, by measuring progress and trends over time, and disaggregated data and quantifying gaps in outcomes for particular populations. This edition includes trended data for up to 10 years, which is a shift from previous years, which only included data up to 3. And it also changes how we quantify those disparities by comparing groups to the rest of the state instead of to each other. Next slide, please. We hope that policymakers and other stakeholders in Ohio can use the Health Value Dashboard to disseminate data and findings, to advocate for change, implement evidence-informed solutions, remove barriers to health for Ohioans with the greatest need, and track improvement or worsening over time. So where does Ohio rank compared to the rest of the country? Health value is a combination of the health of Ohio's population and what we spend on healthcare. We've produced the dashboard 7 times in the last 12 years, and the story has remained pretty consistent, including for this upcoming 2026 edition, which is that Ohio is ranking in the bottom quartile of states. In 2026, we rank 43rd on health value. And what this means is that Ohioans are living less healthy lives and spending much more on healthcare than people in most other states in our country. In the dashboard, we measure the many factors that influence our health listed here, and we rank Ohio compared to all 50 states on each of these areas. And so here are those high-ranking domain, those high-level domain ranks. Access to care has consistently been Ohio's best performing domain. We rank 14th in the 2026 edition. So that is in the top half of states on things like primary care access and employer-sponsored health insurance. And this is so necessary for good health, but it's just not sufficient. These other drivers are also critically important. And unfortunately, Ohio ranks near the bottom of states on measures of avoidable hospitalization, the timeliness and the effectiveness of the care that we're receiving in the healthcare system, and other such measures. We also struggle with public health and prevention, things like the size and capacity of our state and local health departments, tobacco prevention funding, and the emergency preparedness of our communities. The social, economic, and physical environments, like the food we eat and how safe we feel walking in our communities, can either support or hinder good health. And Ohio is ranking lower on those areas as well. Next slide, please. So we did some things a little differently this year. In the 2026 edition, we split our content into 3 distinct documents, and I'm going to give you a little tour of each one of them. The first one I want to draw your attention to is our snapshot. The purpose of the snapshot is to provide this high-level summary of the findings from the dashboard. If you only have 5 minutes, this should be your first stop. The second document is our key findings, and that is what Haley will be reviewing with you shortly. The 16-page publication includes findings from the data and also takes a closer look at the Ohio populations that are facing the greatest challenges to achieving good health. And the third document that I'm going to walk through with you is the data book. This 24-page publication includes much of the data that's traditionally included in our dashboard, like our full ranked data tables for over 120 metrics. It also includes a new addition of some high-level domain summaries, as well as disaggregated data tables for many measures. So I'm going to give you a closer look at one of those 7 domains here in the 2026 data book, and then give you a tour of some of the other resources that are available to you. So each domain begins with some narrative and calls out some notable findings relevant to that domain. We also included a new quick facts section, which includes analysis of the best and worst ranked states and metrics, as well as those that have most improved or worsened in that domain. Next slide, please. Next, we will have the classic dashboard ranked tables, which include descriptions, the most recent value for Ohio, and an analysis of trend for each metric where available for up to 10 years of data. Next slide. And finally, for each domain where it's available, we include relevant disaggregated data. And this is something that's new to our dashboard this year. Each metric is disaggregated by every group possible based on the source and availability. And you see them all listed out together, as well as the disparity ratios for each group. Next slide, please. Okay, before we talk about the key findings of the dashboard, I also wanted to make you aware of some of the other resources on the 2026 dashboard webpage. Our technical documentation is included in our methodology, where you can find information on our development process, metric changes and considerations, and some data limitations. The FAQ includes answers to general questions about the dashboard, as well as some common questions that we get about our metrics, and some descriptions of our methodology in more non-technical plain language. Our facts and figures include a PowerPoint with all graphics from the report downloadable for public use. And finally, our data appendix includes metric descriptions, years, sources, and all underlying values for the disparity ratios that we include in the document in a conveniently organized Excel. Next slide, please. I also wanted to elevate that all the disaggregated data is sortable and filterable in this edition of the dashboard appendix for your ease of use. So you can easily search for a particular topic or filter for a particular group of interest and find all the data on that group in one place. And we use all the data in the appendix and the data book to produce these concise high-level findings and highlight effective evidence-based policies that can address Ohio's greatest health challenges. So Haley is going to take you through those next. And in the meantime, I'll be taking any questions that you have in the chat about the dashboard resources. Haley?
Great, thanks, Lexi. And thank you all again for joining us. It's so good to be with you and celebrate the conclusion of a couple of years of work that we've done in partnership with so many of you to produce this collection of resources. And my name's Haley Aka. I'm the Vice President of Operations and Strategy at HPIO, and I get to review our high-level key findings and then moderate a panel of my colleagues where we can dive in a little bit deeper. Before we look at the key findings, I just want to orient you to what is on each of our key findings pages. What you'll find is some trend data that examines some change over time and some of the key factors contributing to health in our state. We also look at drivers of those trends on each of the key findings pages. On each page, you'll also see 3 considerations for policy progress. These are evidence-informed policy options to improve upon the data that we see in the finding, as well as an acknowledgement that policy progress relies on the intentional efforts that we all make to reduce barriers for Ohioans with the greatest need. I'm going to walk us through, like I said, each of those key findings, and then we'll talk more in depth when my colleagues join me on the panel. Okay, our first key finding is that mental health outcomes are trending in the wrong direction. We've mentioned a couple times the dashboard in this edition contains long-term trend data up to 10 years, which allows us to look at how things have changed since before the pandemic to now. What we see here is that in 2024, an estimated 2.5 million Ohioans, that's more than 1 in 4 adults in our state, had depression. That trend has gone up over time for both of these measures, and Ohio ranks worse than most other states on these metrics. There are many factors that contribute to these increased trends. One that we note in the key finding is Ohio's performance on metrics of economic stability and social disconnection. When compared to other states, Ohio ranks poorly on measures of labor force participation, food insecurity, older adult social isolation, and incarceration. These are just a few examples of challenging social and economic conditions in our state. These experiences of instability and disconnection can lead to prolonged stress, which contributes to poor mental health. The second key finding is that rising healthcare costs strain Ohioans, employers, and the healthcare system. In Ohio and across the nation, healthcare costs are rising. These rising costs put pressure on health systems. They also leave Ohioans with less room in their budgets for other necessities and put increased financial pressure on businesses and all types of employers who offer health insurance to their employees. From 2015 to 2024, both the employer contribution to health insurance premiums and the employee's contribution to those premiums rose steadily. At the same time, more than 1 in 4 Ohioans have trouble paying their usual household expenses. Rising premiums do not fit in the monthly budgets of many Ohio families. The third key finding pulls out some of the high points in this year's data. We see evidence that policy action is leading to improvement in child well-being while acknowledging that challenges remain. Here are those improved trends. For data related to adverse childhood experiences, high school graduation, and disconnected youth, which is a measure of youth ages 16 to 24 who are not working or in school, we see improvement over the last 7 to 10 years, depending on the measure and how much data was available. Ohio is also ranked in the middle of the pack among the 50 states on each of these measures, which is not too bad, especially when you look at where we perform in some other places. In recent years, Ohio policymakers have dedicated effort and resources to improving child health and well-being. That's happened at the state and local level, and with many partners across the state putting intentional focus here. It looks like families are realizing some of those gains. And some children are still experiencing barriers, including children and families with low incomes. Here we see each of these measures disaggregated by income, and across all cases, children from low-income families are more likely to have poor outcomes. This hits on a theme that emerged across the dashboard that Amy opened our conversation with, that Ohio's progress overall relies on intentional efforts to reduce barriers for Ohioans with greatest need. For example, if disparities for low-income children were eliminated, more than 72,000 fewer kids in Ohio would experience ACEs. Speaking of disaggregated data in the dashboard, Edition has a set of population spotlights that highlight data on these populations. So while Lexi showed us the disaggregated data tables that exist in the data book, in the findings book, we get one-page narrative and graphic illustrations of what some of these barriers look like. I'll share just one example for us. On the spotlight on Black Ohioans, the dashboard highlights the gap in outcomes for maternal mortality. Black mothers in Ohio are 3 times more likely to die from complications related to pregnancy and childbirth than other Ohioans, which signals that not everyone has what they need to live a healthy life before, during, and after pregnancy. Healthy births are shaped by many factors, including access to quality care, stable housing, economic opportunity, and experiences of discrimination. The spotlight highlights the gaps in experiences for Black Ohioans in several of these areas. By addressing these barriers, Ohio can improve health outcomes for mothers and babies across the state. For example, if gaps were closed, nearly 140,000 Black Ohioans would no longer be severely housing cost burdened, which would mean spending more than 50% of their income on housing. The experience of safe and stable housing is an important support for healthy pregnancies and births. And again, the dashboard includes population spotlights on 6 demographic groups. We encourage you to dive into the document to learn more about all that's included there. Okay, with that overview, I am so happy to be joined by Carrie Almasy, Becky Carroll, and Brian O'Rourke, my fabulous colleagues and co-authors of the Health Value Dashboard findings. Hi friends, they're coming on screen here. We're going to explore a little bit more in depth what stood out from the data in this edition. I'm going to walk us through a few questions, and I'll ask my colleagues to introduce themselves the first time they chime in, if that sounds good to everybody. So, hey guys, I wanted to start us here because we pulled the data from the dashboard, all 122 metrics back in the fall. We did the analysis through the winter. We've been poring over the results through the spring. We have spent a lot of time with this data. So my first question to all of you is, as you've been looking at it, what stood out to you most from the findings across the dashboard data? And anyone can start.
Go ahead, Becky. I can go first. So just to introduce myself again, I'm Becky Carroll. I have led a lot of HPIO's work lately related to children, children's health, adverse childhood experiences, and mental health. So you'll see maybe those themes across my responses. But in terms of Haley's question, two things really stood out to me. First, like she presented in the key findings, we are seeing a lot of Ohioans struggling with their mental health. And of course, this is concerning for lots of reasons. I mean, for one thing, this results in lost productivity, which has an economic component. And then secondly, it can lead to poor coping mechanisms. And that those poor coping mechanisms impact physical health negatively. And I know our minds pretty much usually go first to things like overuse of alcohol and illicit drugs. But also, I can say, as someone who does deal with depression, when I'm depressed, it is so much harder to motivate myself to exercise, to get out and be around people, to not eat a bunch of junk food. So really, all those things are going to have impacts on physical health. So I think that, we need to make sure we're supporting people who are dealing with mental health struggles and also ensuring that treatment is readily accessible. And then the second thing I'll mention is that 2 of our 3 worst performing metrics across the entire dashboard relate to access to dental care for children. So we rank 48th on, I need to make sure I get this right. Let's see. Dental caries related ED visits among children with Medicaid. So ED visits for dental pain, dental decay, cavities. And then the second metric is access to preventative dental care for kids. We know that dental pain is a common reason for school absences, and it's actually been found to be associated with worse education performance. So, that's concerning. I will mention that there is a bright spot that Ohio ranks fairly well compared to other states in terms of our Medicaid reimbursement rates for child dental services. So that's a movement. That's movement in the right direction in terms of getting providers more willing to treat patients with Medicaid and be involved in the Medicaid dental networks.
Thanks, Becky. A lot of good stuff that came out there for you. Brian, what stood out to you in the data?
Yeah, thanks, Haley. Quick intro, I'm Brian O'Rourke. I'm a healthcare policy analyst here at HPIO. I work on a lot of our projects related to Medicaid, changes to health programs due to HR1 and other policy developments, and healthcare spending and costs. So you'll also hear a little bit about that across all of what I talk about today, most likely. And perhaps unsurprisingly, and probably not surprising to most of the people here, one thing that really stood out to me is that we have seen some greatly worsening trends across a variety of healthcare spending metrics, especially those related to healthcare costs themselves. This isn't really something we could actually see in previous iterations of the dashboard very much because we had that much smaller trend length. But now having the 10 years of data for many metrics means we can see longer term movement in both how Ohio ranks as well as changes in the raw values themselves. So Haley mentioned one really important example of a worsening trend in healthcare spending with rising premiums for employer-sponsored health insurance, which has which has increased by thousands of dollars in the last 10 years and definitely burdens both employers and employees. We're also seeing concerning trends across metrics like deductible amounts, prescription drug costs, Medicare spending, and more across, again, this whole world of healthcare and healthcare spending. And for some of these metrics, we actually perform better than many states. Our employer-sponsored premiums for family plans is an example of that, where we ranked 6th. But the movement is just so consistently in the wrong direction across all 50 states that it's really hard to take solace in the fact that we still have a favorable ranking in Ohio. And one more metric I'll quickly shout out is that we've seen a significant worsening in Ohio on our metric related to adjusted hospital expenses. We know that hospital prices are one of the top pressures on rising healthcare expenditures, so this is something we need to be thinking about here in Ohio specifically. And again, the idea of rising healthcare costs and increased strain on Ohioans and the healthcare system isn't really a new concept, I think, especially to people here on this webinar, but it is something we see really playing out in the 2026 dashboard and an area that we're going to need to pay a lot of attention to going forward.
Thanks, Brian. All right, Carrie, let's it out to you.
Hi, everyone. I'm Carrie Almasy. I'm the Director of Assessment and Planning here at HPIO, and I also get to lead a lot of our work around health equity. And so one of the things that stood out to me, like Brian, was in getting to see that 10-year trend for the first time. And in seeing that trend, I was really struck by a lot of the improvement that we saw in the physical, social, and economic environment. Yeah. It really surprised me that we saw less poverty, fewer ACEs, over the course of that 10-year period. And it was heartening to me because we had also seen increased policy attention and focus in a lot of those areas. But at the same time, that excitement was tempered by the fact that despite that progress, we're still seeing gaps in outcomes for groups of Ohioans. Those gaps were remaining. Haley, I think you have a slide on Ohioans with disabilities that I would love for you to
right there.
Yeah, thank you. So despite progress, for example, Ohioans with disabilities are still facing barriers to participating in the labor force. So what we see here is that the percentage of Ohioans with disabilities who are not in the labor force, so who are not employed or not looking for a job, decreased by 7% over the past decade, but they remain 2.4 times more likely to not be participating in the labor force than Ohioans without a disability. So until we as a state focus policy attention on Ohioans with the greatest needs and overcome barriers that Ohioans are facing, like access to transportation and having adequate workplace accommodations, we'll continue to see these disparities.
Thanks, Carrie. Thank you. Also, you guys all pulled out some really helpful measures that caught your eye, things that stand out to you in particular areas. I'm wondering, as you look across the whole of the dashboard, what stories come to mind for you that tell you about how Ohioans are really doing? What can the dashboard tell us about their experiences, or maybe sort of a big picture story that came out for you? And Becky, let's start with you again.
Okay. Well, the first thing that comes to my mind is something that I'm sure many people on this call have heard hundreds of times from HPIO and even have heard earlier this morning. It's that Ohioans continue to live less healthy lives and spend more on healthcare than people in other states. Since the beginning of the dashboard, Ohio has ranked really poorly on population health, and there's a lot of reasons for that, of course, but one thing that jumps out is our measures related to tobacco use. We've consistently ranked poorly on adult smoking. This edition of the dashboard, we ranked 43rd, and then we've also consistently ranked poorly on the percent of children exposed to secondhand smoke, and we rank 47th on that metric. We also rank worse than most other states on the amount we spend on tobacco prevention. And as part of our dashboard analysis, we do what's called a correlation analysis. And that has told us that the states who have lower adult smoking rates perform better on health value. So tobacco really seems to jump out as something that we can make progress on in order to improve our overall health value ranking. And also, when you think about it, the research has shown that tobacco is tied to so many poor health outcomes, cancer, infant mortality, so things that we're really concerned about here in Ohio. So definitely something that we should be keeping in the forefront of our minds, in my opinion. But we have seen good news. So over the 10 years of data that we analyzed, we did see pretty significant declines in both of these metrics, in adult smoking and children exposed to secondhand smoke. So there is movement in the right direction, but we just need to keep that focus.
Going. All right, Carrie or Brian, either one of you, I'm willing to hear. What stood out to you in sort of the big picture story of the dashboard?
You go, Gary.
Okay. I'll continue with the theme that I answered my last question with. Just that when we look at the page that was brought up, it's part of our section of the dashboard that's called Spotlights on Ohioans that talks about the experiences of different groups of Ohioans in our state. And one of the elements of those pages is that it quantifies the number of Ohioans impacted by these disparities, by these gaps in outcomes. And it really struck me looking at that, how much deeper it goes than what we see on these pages about how we're really talking about people and populations impacted in our state, and how there are thousands upon thousands of real Ohioans impacted by these numbers. And that I think the overall thought that struck me is that a healthy and vibrant Ohio is really dependent upon healthy and vibrant communities, that Ohio depends on all of its people to be healthy and well, to be economically stable and vibrant. And so Ohio and everyone in our state, all Ohioans benefit when we all have the opportunity to be healthy.
Ryan, I feel like you have a takeaway that is so closely tied to Carrie's. Do you want to share what stood out to you? I think you're muted.
I swear I clicked on mute, but start again. I do think it is related, and it is really just about like the lived experiences of Ohioans around the state and Ohio families who are, working to afford healthcare and everything else. I think even before the most recent pressures that we all probably know about on affordability coming from major policy changes and other economic forces, which I'm sure we're going to talk about more later, we can see in a lot of metrics that Ohioans are struggling with the cost of living. And those are areas that are closely associated with being able to live a healthy life. So we rank poorly compared to other states on measures like food insecurity, poverty rate, unemployment rate, childcare cost burden, and more. So just to pull one of those out, for a family with 2 children, over 30% of a household's income is needed just to cover childcare expenses on average. And the disaggregated data, like Carrie was alluding to as well, shows that the effects of cost of living pressures are not evenly distributed in the state. So for instance, we are seeing large disparities across race, disability, income, and education status for measures like child food insecurity. And Haley, if you could pull up the map slide quickly. At HPIO, we've been doing some work on healthcare access and affordability that I think Jacob actually linked in the chat a couple minutes ago as well. And it's, really focusing again on these issues with the cost of living forces that we do see reflected in some of the dashboard data. So all of these different pressures I've mentioned, including paying for food, for healthcare, childcare, housing, and more, gas as well is now a big conversation, come together to require larger and larger proportions of Ohioans' budgets, as shown that by this data on the slide from the United Way, where in Ohio, a family of 4 with 2 young children needs almost $80,000 a year to afford basic needs in the state, which is much higher than a lot of people make in terms of household income, and also with important variation around the state as well. And so again, I think one really important part of this is that these pressures are likely to change and potentially worsen moving forward with cuts to programs like SNAP, Medicaid, and other social supports that are coming about right now. So that's also something we need to be thinking about, moving past the sort of health value dashboard data and what we had here in 2026.
Well, that's a perfect transition to where I'm hoping to go next, Brian. So maybe you can hang on with me another minute, because one limitation we all know exists with the dashboard or anything that relies on publicly available data is that it's not always super up to date, right? The most recent data that we have in the dashboard, because it's the most recent data available to us, I believe is 2023 data. Maybe we have a couple of 2024 numbers in there. So let's just talk a little bit about how current policy developments, things like the Federal Reconciliation Bill, HR 1, but other state and federal changes as well, intersect with what we're seeing in these dashboard outcomes.
Yeah, I can continue. Definitely related to what I was just talking about.
Right.
But from that healthcare access dimension, the dashboard does, again, capture this, like Haley just said, pretty stable period before HR1, which is also called the One Big Beautiful Bill Act, as well as some other major policy changes that we're seeing in the last year or two begin going into effect. So, of course, this does include major Medicaid and Medicaid eligibility and financing changes, which we have some pieces on at HPIO if you're interested. Cuts to SNAP, which we also have a piece on HPIO, and restrictions to ACA marketplace plans, which is developing in real time as well. And so in some of the most recent data, some of which isn't even captured in the 2026 dashboard, we can already see indications of strain, including a rising uninsured rate after a pretty long period of remaining relatively low in Ohio. So we've seen an uptick in the uninsured rate since 2022 here in the state, and we're likely going to see that increase even further in the next few years. And because these policy changes and HR1 affect such a wide range of programs like SNAP for food assistance, Medicaid for health access, changes to housing assistance as well, the concerns that we're going to see potentially some backsliding across different areas related to dashboard metrics like food insecurity, receiving needed mental health care, out-of-pocket healthcare spending, and more. And I think the other vantage point that's really important is also the additional strain that this could put on the healthcare system. Think about especially like emergency departments, rural hospitals that are already really financially strained, which can potentially raise healthcare costs even further as health services are potentially delayed or forgone. Social drivers of health are left unaddressed or addressed in worse ways, and providers kind of face these higher levels of uncompensated care. So it will be very interesting to see how things change as we get the updated data, and that will likely be reflected in the 2028 Health Value Dashboard.
Yeah, thank you for that. Carrie and Becky, I want to make sure we reserve some time to talk about policy action, what we should do next, but I'm curious if there's anything you would briefly add about current policy changes, reactions you have to what Brian shared as well.
Really quickly, just because we had a question about this in the chat, I saw one of the things that we've been dealing with in this edition in the dashboard and more broadly are changes in data availability due to some changes at the federal level. This is true across measures in the dashboard and sources like CDC Wonder and the census, but it has been especially true for accessing disaggregated data. For instance, some federal survey data, we're seeing questions removed and data taken down that references things like sexual orientation and gender identity. This has happened in sources such as the Behavioral Risk Factor Surveillance System and the National Survey on Children's Health. And this makes it even more difficult for us to measure outcomes for groups like LGBTQ+ Ohioans. And when it's harder to get that disaggregated data, it's harder to do anything to fix the underlying drivers of the disparities that we're seeing in Ohio.
Thanks, Carrie.
I want to bring up one positive. As Haley mentioned earlier in the webinar, we did see quite a significant decline in adverse childhood experiences, which is very exciting to see. And I just can't help but think that that was tied to recent policy work. We know that since Governor DeWine took office, families and children have been a priority for him. Lots of initiatives creating the Department of Children and Youth, the Children's Services Transformation Advisory Council, a focus on home visiting. And of course, then the legislature, the Ohio General Assembly, has been involved in those things as well as passing other child-focused metrics or measures, initiatives. And then we've also seen really exciting work at the local level too, in lots of areas of Ohio to support children and families, and some specific work around trauma, which has been great. But I will say that shifting things like this really takes time. And if this policy focus is not continued, such as after Governor DeWine leaves office, we may not reap all the benefits of that work.
Well, let's keep thinking about that. I'd love to end our panel here thinking about, based on the data and the things that we're seeing, and also the environment at large, where should policymakers and partners focus their efforts next? The dashboard includes, for each of our key findings, as I mentioned before, we have a few policy considerations for progress called out. I think my colleagues might mention some of those. Also curious to hear in the chat what you guys are seeing and thinking about as we head into a new governor, a new General Assembly. And I'll just prepare everyone. This is our final prepared panel question, and then we've reserved just a few minutes to hear from you all. So continue to throw your questions in the chat, and we'll hopefully get to a few of those. But okay, who wants to start thinking about where policymakers should focus next?
I'll jump in just to kind of continue my thought.
Yeah.
So again, continuing that focus on children, I think, is really important. I also think taking action around mental health prevention would be very valuable. So an example here would be increasing or creating more opportunities for social connection. Specifically in the dashboard, we saw that Ohio ranks very poorly on social isolation among older adults. So, the state could increase investments in older adult activity programs and senior centers, which have evidence of effectiveness of improving those social connections. And a separate thing is, I think that we need to have some additional attention on improving access to mental health care, specifically in terms of expanding and strengthening the behavioral health workforce.
Thanks, Becky. Brian, what would you call out?
Yeah, I have two pieces. One I would quickly shout out is, because especially as I'm reading the chat, just remembering to say this, that like one of the key pieces is going to be just trying to respond and potentially in some cases mitigate the impacts of these policy changes I've been alluding to Medicaid, SNAP, all sorts of programs and funding sources that are coming from HR1. Of course, that's not super proactive, which is, unfortunate, but it is a really important area. There are concerns about specific populations. I'm seeing older adults get called out, which we completely agree with, and is an area we've been talking about doing some spin-off work related to, because of just particular risk of losing access to things like SNAP or Medicaid for some people as well. So that's something we definitely need to be keeping an eye on in the state. There are things Ohio will need to do for our Medicaid budget, for example, to make sure we keep our Medicaid program financially secure, things like that. The other piece that I would, highlight that I think is more proactive is looking a little bit at how other states are addressing growing healthcare expenditures. Again, this is not an Ohio specific issue. This is something that all states are reckoning with right now. And if you look across the country, you can find a lot of approaches that states across kind of the political spectrum are taking to address rising healthcare costs. So there are all sorts of areas that, different policymakers are addressing, from pricing regulation, thinking again about hospital costs being a metric that we do particularly poorly on here in Ohio, addressing private equity in healthcare, looking towards consolidation and the effects that has for patients and for healthcare costs, alleviating the burden of medical debt, pharmaceutical system reforms, price transparency, and there's honestly even more than that.
No shortage.
No shortage, exactly. And of course, these approaches touch on a lot of different parts of the healthcare system, which is important because, especially at the state level, there aren't really going to be one-stop solutions when it comes to rising healthcare spending right now. And so I think in this space, it's really important to look towards the research literature and the body of evidence that can help us understand, the consequences of these different approaches that states are taking, including, of course, whether they actually lower healthcare costs, but also whether they have other outcomes, whether they're affecting things like access to care or care quality as well. And one just key part of that, I think, in this conversation is collecting more data. That's why we recommend approaches like all payer claims databases in the dashboard. which can help policymakers and system stakeholders understand cost drivers in the state, which of course might be unique from state to state or even have regional variation here in Ohio. And that can help us target specific policy mechanisms to address these problems. So that's a great place to start. I do want to, emphasize that more information by itself does not solve rising healthcare costs, but it is an important piece of it, and it relates to some of these conversations we've been having more broadly about data availability, the availability of evidence, which is sort of the foundation to actually, making meaningful policy change.
That's great. Okay, Carrie, what's on your mind?
I'll keep it quick so we can get to an audience question or two.
Perfect.
But what came to mind for me was that Ohio leaders and policymakers can create policies and focus our attention on reducing barriers to health and well-being. We can leverage the data that we have, including disaggregated data, collect more, and make sure that we are combining that with community input to implement fair and just policy solutions that eliminate gaps in opportunity, such as those that we highlight in the dashboard itself. A good example of a policy that I think does well in this space is the Maternal and Infant Vitality Initiative. That's a collaboration between the Ohio Department of Health and local partners across the state. And it's focused on closing gaps in the 10 counties in Ohio with the largest disparities in birth outcomes, like infant mortality. So I think that the more we're able to focus on policies and solutions in that space, like that initiative, the stronger Ohioans will be and the stronger our state will be overall.
Thank you so much, all of you, for your thoughtfulness and all of the work that you've done to get the findings to where they are. It's such a valuable resource. So I'm going to invite Amy back on to ask us a question out of the chat.
Well, first I'm going to take a question from the chat and respond to it.
Great.
And then ask you all if you have anything you'd like to add. We've had a very active chat and Q&A box during this session. I think it's the most active we've ever had. So we've done our best to respond to questions as they come in, and we'll pose some to our panelists. So one question that a participant asked was, have efforts to ban DEI that limit research and initiatives that discuss topics like racism and health equity affected this work? It has certainly influenced our thinking about this work, and I'll share two ways in which we have responded or adapted our thinking. One is that we intentionally, one of the reasons why we did the whole separate data book this time is that we wanted to present all of the data that we've analyzed for the dashboard very transparently and proactively. So always in the past, that data was available and it was posted on our website in Excel spreadsheets. But you had to take a couple steps to get there. So this time we wanted to provide all of the information in its own separate data booklet, and that includes all of the disaggregated data so that those who are reviewing the dashboard materials have that more easily at their fingertips. We've linked to it quite a lot in the other documents as well. So if you ever have a question about a particular metric or something we've highlighted in the dashboard and you're curious to know what other data exists for those disaggregated metrics, you can go there and take a look. And again, it does pose often more questions, it sparks more questions, but it gives a starting place for conversations. And then the other piece I would mention is that nothing about the evidence behind health equity or the need to address racism or discrimination has changed. What we are being very intentional about, though, is explaining those connections, the linkages between various forms of discrimination and systemic practices and how those result in poor health outcomes. So you likely see kind of more of that storytelling in this version of the dashboard. I guess I'd call it the connecting the dots between various metrics and the end results that we would all like to be seeing. So I'm going to ask my colleagues if they have anything to add or clarify about what I just said.
I think you did a great job, Amy.
Yeah, you hit it all.
Just adding that there are other things that are affecting our ability to continue to do this work, like availability of disaggregated data that I mentioned previously.
Great. We've had several questions in the chat about older adults and data related to older adults, in particular, as we see cuts to SNAP and changes to Medicaid coverage. So would anyone like to speak directly to those challenges experienced by older adults?
I can start quick.
Okay.
Yes, I think older adult population is a group that really does need particular attention. Like I mentioned, I think this is an area we are really thinking about doing some like spinoff and getting some additional data that's focused right in on the older adult population. Some of that is just from the overall angle of affordability. We know older adults generally have higher healthcare needs, which, as we've also established, tends to be quite expensive and a serious pressure on cost of living. You can also obviously see reduction in income for people who retire, things like that. And so there is just I think a real emphasis on making sure, on putting particular attention on these affordability pressures that we've been referencing throughout the webinar with respect to older adults specifically. And then the, policy changes, programmatic changes part, I think SNAP and Medicaid are the two that I think of most directly. SNAP has had changes to its work requirements that are going to affect older adults specifically and potentially threaten their access to food support. And then with Medicaid, because of things being instituted like work requirements, especially the older adult population that isn't already, transitioning to Medicare at age 65, which has its own sort of costs and affordability concerns. There are issues that we've seen identified, the AARP, for example, just general worries about, internet access, broadband access, being able to navigate these new work requirements, processes, to keep appraised of all of these things. And, again, the significant consequences that can come about if you do lose access to health insurance, to food support, things like that.
Can I just add a quick bright spot is that Ohio was designated as an age-friendly state this past year. So I do think that there is acknowledgement at the state level of the need to make sure that we are focusing intentional effort on integrating and thinking about older adults across all aspects of our communities, and this is a big what's the word I'm looking for, priority for our current administration.
I'll add one other thing. Our team recently released a brief on changes to Medicaid financing that came about as a result of HR 1, and those decisions that policymakers in the state are going to have to make are likely going to have implications across the board. Some other states are cutting reimbursement rates, some are more proactively cutting eligibility or optional services. So I think that is something that we need to really be keeping an eye on, especially for a population like older adults that we might be prioritizing.
Okay, well, thank you all. I think we're about at time, so we're going to move on. Really appreciate all of you sharing your insights. I hope it's clear to everyone that a lot of thoughtfulness goes into the creation of the Health Value Dashboard. Everyone in our team plays a role in the production of these documents. We hope you have found them to be useful and will continue to share these resources with others, including our state policymakers and future policymakers who may benefit from having this foundation based in data. There are lots of ways, a quick reminder of the ways that you can influence the policymaking process. And one of those ways is by just simply sharing data like what you heard today, perhaps using this data as you write letters or provide build testimony, and organizing community partners to learn about this data would be another way in which you can influence policy. So please consider these ideas. Next slide. All right, we have those poll questions. Please don't leave yet. We'd love to get your feedback on this webinar. So first, we want you to rate our speakers and our panel moderator and the panel as a whole. Remember to scroll down on the poll that just came up so that you get all the questions. This will only take a few seconds, I promise. We'd also love to know whether this forum was successful in increasing your understanding of the findings and data that's available in the dashboard, and your knowledge regarding at least one policy consideration that can improve health value in Ohio. And then finally, we'd love your feedback on the overall quality of this forum. This is the first time we've ever hosted an all HPIO webinar, just featuring only our staff. We'd love to get your feedback on that. And then also, we'd love to know if you're going to use this information to influence the public policy making process, and whether you're going to use this information to influence the work of your own organization. All right, so there's a total of 11 questions. As I said, it should only take you a few seconds to respond to those. And we do indeed use this data to plan our future events. So it's very helpful, and we appreciate your feedback. I think we have one last slide. So we are again going to host our Health Policy Summit. This year, we're going to do it a little earlier on Wednesday, August 26th. Please mark your calendars. We'd love for you to join us. It's going to be up at the Ohioan Hotel and Event Center in Lewis Center. So you don't even have to go downtown. We're staying right around the outer belt to make it more convenient for folks who are coming from outside of Central Ohio. So please save the date, and we'll look forward to being with you then, and likely before then, because there will be more webinars before then. So hope you all have a great day. Thanks again for your attendance and for utilizing the work of the Health Policy Institute of Ohio.